Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at GOLD. And we are preparing here at GOLD for the GOLD Midwifery Online Conference of 2023. And it's just around the corner. I'm so excited about it. And here with me is a special guest, Molly Dutton-Kenny. Welcome, Molly.
Thank you. Thanks for having me.
It is wonderful to have you here. You are one of our speakers for the conference, of course, and you will be presenting live on February 13th, depending on what time zone you live in, of course. And first of all, I would like to know, where in the world are you located?
Yeah, I'm located just outside Toronto, Ontario in Canada, but I am an American and was trained as a midwife in the United States, in West Africa, and then lastly in Canada.
So you have a broad area there that you covered in clinic as well. So you worked in the United States as well as a midwife too? And
briefly, yes.
Briefly. Perfect. Wonderful. Well, thank you so much for sharing that here. And talk a little bit about your practice. Are you a home birth midwife?
Yeah, so I'm a registered midwife in Ontario in Canada, which means that I have hospital privileges and I attend births in home. My area doesn't have a birth center, but we do about 10 to 15% of our births in people's homes, and the majority in our local hospital. And then we also have a community clinic for prenatal postpartum care, as well as home visits for those things.
Beautiful. That sounds absolutely fantastic. You are a holistic midwife, is that correct?
Yes.
So talk a little bit, what does that mean for our viewers here? What does that entail?
So I feel very blessed to have been trained by a lot of holistic midwives, which for us often means that we are very skilled in using alternative and holistic medicine alongside our midwifery practices. So skilled in using herbs, homeopathy, psychology, and all kinds of other ways to help people manage what's going on in their bodies throughout reproduction. So yeah, I feel particularly bent towards a natural lifestyle and support for our clients, which is very welcome alongside a lot of clinical and medical knowledge.
Absolutely. And I believe you're pretty knowledgeable about herbs, right? That's absolutely fantastic. I feel like that is a little bit of a, I'm glad to see it come back to life. Basically, I feel like it's not a lost art. I wouldn't say that, because many midwives are really, really excited and interested in herbs. But the knowledge, there is so much to learn, right? It is a full degree just to become trained in that and do that and grow these herbs and use them in clinic. But I find it fascinating. It's wonderful. And we definitely need more of that as well here in our areas. So now let's talk about the big topic here. Your topic you're presenting on is respectful pelvic exams from a trauma-informed lens. And that's a very big topic. Pelvic exams is something like, if we think of as a woman, as myself, not only as a midwife, but as a woman, we know how vulnerable and we feel if we have our own annual exams, for example. And it always feels like you're giving your power away, right? You're laying there, you're helpless, basically, right? And looking at that, as midwives, it is so important to see what can we do better, and what can we do different. So talk a little bit about respectful pelvic exams.
Yeah, thanks. I'm really glad to be talking about this topic. It's one that I feel really passionately about as a midwife. And I agree that a lot of people experience pelvic exams from a space of disempowerment. And I think that we as midwives really have a huge opportunity to treat that differently in our practices and to teach people how their bodies should be treated during these experiences. And I think one of the biggest things I like to challenge midwives in is using the opportunity of doing pelvic exams with our clients as an opportunity for building trust with our clients, as opposed to taking it away, and really showing that deep respect for people's bodies and their reactions to these experiences. So one way of doing that is by really deeply understanding understanding trauma in people's lives. So in this presentation, we're going to take a look at historical traumas, cultural traumas, and ways that people's bodies have been treated throughout generations and cultures that is still being carried with people today. As well as just personal histories of how people have touched and treated our bodies at different times, and how that can create even just involuntary reactions in our bodies when we're having these intimate exams with our midwives. And then also just some practical stuff for midwives about how to, rebalance that power in the room, and how to, work hard with that understanding of trauma in people's lives. How do we then work with this exam? How do we use terminology or tools or scripts in our language to make this a better experience for people, or as best as it could be? So yeah, I think we have a lot of room for growth as midwives, and a lot of potential to make this better.
A lot of room for growth, and yes, and I like how you mentioned potential, the seeing it as an opportunity to build trust. To I really that really speaks to me, and looking at it from a trauma-informed lens, because we don't know who walks into our office or our clinic, right? We don't know their background. Some of our clients are open that they have experienced trauma in the past. Some don't, and some maybe don't even a pelvic exam maybe brings it out, something that maybe that they had suppressed in an experience.
Absolutely.
That they maybe even not, I wouldn't say aware, of course their body is aware, but that they hadn't thought about maybe in a long time. So definitely something we need to practice with all our clients, no matter who, if they disclose trauma or not.
I agree. Yeah,
absolutely. Yes, absolutely. Overall, pelvic exams, are we doing too many as midwives, as care providers?
So. I think so. I think that another thing we can really reflect on in our practice is how often we're doing pelvic exams and how many of them are really necessary. Definitely, like you mentioned, an annual pelvic exam has been shown in literature, and most of us in community would say likely unnecessary for a lot of people. And there are some things that midwives need to do pelvic exams for, right? Like we are a profession and a population that does do this when we're doing, pap smears, IUD insertions, checks during labor, all kinds of things. Like it's something we interact with all the time. I do think we should have a good interrogation of the frequency we're using it. And a healthy acknowledgement that we do need to use it pretty frequently in our profession. So it's a worthy one to interrogate in ourselves for sure.
Absolutely. Well, Molly, I can't wait for this presentation. As you mentioned, there's so much room for growth, and I personally love learning and expanding my knowledge, and I can't wait to learn more from you here during our GOLD Midwifery Online Conference. Thank you so much for coming in here today and chatting with me about this topic.
Thank you so much. Looking forward to it.
And for our audience now, if you are curious about the GOLD Midwifery Online Conference, if you want to learn more about Molly and her topic and all the other topics in the conference, and you want to find out more, I invite you to visit goldmidwifery.com to learn more. Thank you, everyone, for watching, and I hope to see you at the conference. Bye-bye, everyone.